More than 13 million women suffer from stress urinary incontinence. Stress urinary incontinence is a condition where the pelvic muscles and tissue have been weakened, causing the bladder and urethra to relax from their normal positions. As a result, sudden abdominal pressure from coughing, sneezing, laughing, or simple lifting can cause accidental loss of urine. What causes stress urinary incontinence? Muscles and tissues are often weakened by pregnancy and childbirth, muscle damage, obesity, menopause, hormone changes, and prior surgery. For women suffering from this condition, you are not alone. Women of all ages can experience stress urinary incontinence. In fact, it may be surprising to learn that 1 out of 3 women over age 45 suffer from stress urinary incontinence. But there is good news. You don't have to live with stress urinary incontinence. From American Medical Systems comes a minimally invasive treatment option for stress urinary incontinence: the MiniArc Single Incision Sling System. MiniArc is a revolutionary new treatment option for women seeking relief from the unexpected and sudden loss of urine. Listen as these women share their experiences with this condition and how they found relief with MiniArc, a minimally invasive outpatient procedure.
Well, I've had 2 children, and after the birth of my second child, I really noticed a difference. And just, even a period of 6 months, it just started getting worse, where I wasn't able to exercise without, going into the bathroom, or, sneezing and coughing. Actually, I was noticing it more and more, especially after the birth of my second child.
Well, my life before the MiniArc procedure was, I often had to be very conscious that if I was going to sneeze or cough or get out of a chair really quickly to chase my children or something, I would usually leak a little bit. So I was very conscious of that, always wore a pad every day, and basically also avoided some activities like running. I typically didn't do that, or the kids would ask me to play catch or football or something, and I would have to say, no, not today, Mom's not going to play. So it was limited in that extent, if you will.
I'm an avid runner, and I had noticed that it really was, changing the way I could run. I was having to take breaks. I couldn't run straight through on my workout. So it definitely was impacting my exercise routine, and jump roping and even lifting heavier weights. All of that had a big impact on it.
Well, for me, the stress incontinence really impacted activities that I did. If my kids would ask me to play a football game with them, or kickball, or a running activity, I would generally say, no, Mom's going to sit this one out. And really that was centered around fear of leaking and things.
I did discuss other treatment options with my doctor, and aside from the Kegel exercises, which weren't doing the trick, I just wanted to go to something that I knew was going to work and be done with it.
My physician recommended to me to have the MiniArc procedure, and talked about that it was a single incision procedure, which I was very favorable about, and that it would lift the opening of my bladder and help with the stress incontinence. I really saw immediate results from day one and was very excited about that, and have really experienced great things, if you will, from this procedure.
The MiniArc procedure is usually performed on an outpatient basis. A small incision is made in the vagina, and a small piece of soft mesh is inserted through the incision and placed under the urethra. The sling cradles your urethra to provide support and prevent accidental leakage. On the left, the pelvic floor muscles are weak and the urethra is no longer supported, allowing urine to escape. On the right, the placement of the MiniArc sling supports the urethra and prevents urine leakage. The MiniArc sling system involves minimal discomfort. Shortly after the procedure, you can return to non-strenuous activities. Patients experience little or no pain, and the procedure can be performed under local, regional, or general anesthesia, depending on what you and your doctor decide.
Well, I felt great after the MiniArc procedure. Honestly, I went home later that morning, and against my doctor's wishes, I ran out that afternoon to do some errands. Maybe not the smartest thing to do in the end, because I did have a little bit more pain than the next day, but I mean, I really did feel pretty good. I had the procedure, the MiniArc procedure, done on a Thursday, and I went back to work on Monday. I could have gone back. My doctor even said that later that day if I really told her I had to. She was confident that I would be fine. So normal activities, again, the next day I was fine. I did wait 6 weeks to go back to exercising. I wanted to make sure that I wasn't going to be, harming anything.
Immediately after the procedure, when I woke up in recovery, I really felt very comfortable. I went home, I was tired, and I slept that day. I wasn't in any pain at all. The next day I was a little groggy, and I tried to take it really easy that first day and even the next day. Didn't feel any pain from the procedure at all, and then really felt like I was able to sort of, get up and interact with my family and the children. I was cautioned not to lift heavy things or strain a lot, and so I was very conscious of not doing that. But in terms of mobility and getting around, I was able to really resume normal activities very, very quickly.
For approximately 6 weeks, no exercise, sexual intercourse, or heavy lifting. Follow all post-surgical instructions provided by your physician.
There are things I can do now that I wasn't able to do before I got the MiniArc. And those really just include a freedom for me that when the kids do say, "Mom, let's go throw the football," or "Let's have a game of kickball," I can jump up and go play that with them. I'm not as conscious of always making sure that I have a little extra pad with me, or I'm prepared. If I sneeze, it's really kind of freeing to know that I don't have to cross my legs. So in that sense, it's been sort of freeing for me.
The results have been extremely positive, no leakage, and yeah, my life is back.
Today is the day. Speak with your physician and take the next step to restoring your continence, restoring your life, and finding relief.